OrthoGeriatrics is orthopedic care for the elderly. With the rising number of elderly individuals, there is an increasing incidence of orthopedic concerns. There are two main arms of concerns. One is joint degeneration, which occurs with age. It can involve any joint, but the knees in particular may be of significant concern due to knee osteoarthritis. The second arm of concern is osteoporosis and the rising incidence of fragility fractures. The rising incidence of hip fractures in the elderly is again a classical example. While joint degeneration issues are mostly non-urgent and are chronic in nature, fragility fractures that occur after a trivial injury are acute and will require immediate medical attention. The management principles remain the same. However, there is a paradigm shift in the approach to management, particularly for acute fractures. The concept of co-management allows all relevant specialists, for example a geriatrician and other allied health, to deliver care in synergy. This is an important aspect because besides the fracture, many elderly individuals have other associated medical concerns that need specialized attention concurrently. This enables early optimization, faster rehabilitation, and less complications. This approach has been scientifically proven to provide superior outcomes in many centers in the world through an integrated model of care, including Singapore. The goal of the multidisciplinary approach for the elderly is to restore function and mobility. Thank you.